What's up, friends? Welcome back to KimmyDTV, a place where nurses and aspiring nurses come to achieve academic and career success. Okay, so welcome to this portion of the video, which is really focusing on our academic part of the academic and career success here on KimmyDTV. Okay, so before I start this video, I want to say thank you so much for all my returning subscribers. And for those who are new to this channel, hey, my name is Kimmy D. Don't forget to hit the like button. Don't forget to hit the subscribe button and share this video, okay? And I also want to apologize about the flyer I made on my Instagram. I meant 2 p.m. Central Standard Time, but for those of you guys who catch it, that's excellent. And for those of you who don't, this video will be put up. So this video will stay up, so you guys will get to see the video, okay? But yeah, so anyways, how are you guys? I hope your Sunday is going excellent so far. Okay, so this is KimmyDTV first ever live med surg review. Okay, so this is going to be a brisk live med surg review. Okay, so who is this review for? So this review is for if you are in nursing school, if you are thinking about going into nursing school, and whether you're about to take your Nclex, whether you are waiting for your ATT number. As one of my viewers messaged me on Instagram, this video is for you because it's going to allow you to learn how to think, how Nclex wants you to think, and how nursing school questions want you to think, okay? And I apologize if you hear anything in the background. There's some people outside. There was no one outside before, but as soon as I press record, some people want to go outside, but you know, that's how life is, right? So okay, so that is who this video is for. And this video is also for those who are very inquisitive, who ask a lot of questions. So if you're someone who always asks a lot of questions, this is for you. If you're someone who, you know, it takes you a while to understand things, this is also for you. On KimmyDTV, I have saying, which is there is no such thing as a stupid question. Okay, because I know how it feels like to be kind of like treated like, oh, she's probably stupid or he's probably stupid because we're asking questions, because I'm a very inquisitive person. If you tell me to sweep a broom this way, I want to know why are we using that specific broom? Is it because of the bristles? Is it because of the way the floor is laid out? I'm very a detailed person, so that is why I always say there is no such thing as a stupid question, okay? So you never have to fear asking me a question. Don't feel like, oh, if you're typing a question, like, oh, I hope this person doesn't think it's a question that's stupid. There's no such thing as a stupid question with me, okay? So our objective, why seek out a separate instructor if you're forking out 20, 30, 40, 50, sometimes even $100,000 into tuition into your nursing school? Why seek out additional outside resources to help you become successful? Well, one of the reasons why is, unfortunately, sometimes when we go to college, some professors really kind of don't care that much about you being able to learn effectively. Some professors just come in, read off of PowerPoint slides, and just give you a test and expect you to know. Or sometimes the professors may care, but there may not be enough time to really sit down and break down the topic in order for you to listen and understand. And there may not be enough time to give that individual attention to each and every student in nursing school, okay? So yeah, you could be smart enough to get into nursing school, but it's like everybody's learning style is different, especially when it comes to nursing school. Everybody's learning style is different. So that's another reason why it's good to seek out additional resources. When I was in nursing school, I definitely seeked out additional resources to help to supplement my understanding, because sometimes professor would say something and I don't understand, And, especially my LPN to RN bridge program, it was only a 1 year program. So I had a very limited amount of time to actually digest all this information. Like my program, it was essentially 1 year, but because of the where I entered into the program, my program was 18 months, right? So there was a lot to digest within just a year. But by the grace of God, thank God, I was able to, create a formula and create a way for me to understand all the information and essentially teach myself. Because, like I said, I was in school like during the pandemic. So some of my teachings were online, some of it was hybrid, but nevertheless, I'm here. Okay. So, what is our objective for today? So our objective is to just learn, like I said, learn how to think how nursing school wants you to think, learn how to think how Nclex wants you to think, in order for you to become successful. Okay. So yeah, college is like, okay, read chapters 1 to 60 and here you go. And you're expected to teach yourself how to learn all this. So this is why I'm here. I'm here to bridge the gap between your understanding of the material and what the professor gives you. Okay. So if you have a professor that doesn't really care, or if you don't understand the professor or what have you, I hope that I can be that resource that helps you walk across the stage and actually help you get to your goals and help you graduate so you can become a nurse, LPN or RN, and so you can realize your goals. Okay. All right. So I said that there's no such thing as stupid questions, and why listen to moi? Okay. For those of you guys who are new to my channel, you don't know who I am. So why listen to me? Well, first of all, um, I believe that I'm able to go down to the level of someone who doesn't know a specific content or topic and able to bring them up there. Okay. So somebody may be able to be good at painting a house, but they may not be they may not be good at teaching you how to paint a house, right? So I feel like you guys always tell me you guys love how I explain things. You guys love how detailed I am. You guys love how detailed I am, like step 1, step 2, step 3, like breaking down the steps, why step 1 is step 1 in that correct order. You guys love the way I explain things. You guys have been asking me for this. And, I'm sorry it took such a long time. It's just that transitioning from New York to Texas, it was a huge transition, and I'm still transitioning. But I'm happy to be here with you guys, and I'm happy that you guys are here with me. Okay, so please give this video a like as you guys come in. I see some people coming in. Please give this video a like. Yeah. So okay, and also why me is that I successfully completed nursing school twice. Yes, I successfully completed nursing school twice for LPN and RN. And in my RN, I actually graduated as valedictorian. And that's all by the grace of God. And I don't say that to brag or to boost my ego. I say that because I would ask questions, and I would be sometimes, depending on the professor or depending on the students in the class, I would be made to feel stupid. Like people like, why are you asking that question? Like, why is this girl asking all these questions? Like, is she dumb? Is she stupid? Is she this? Is she that? Thank you, Scrubbing Squads. Thank you. Hey, girl. Let's put your comment on the screen. Thank you, Scrubbing Squad. Yeah, so not only that, like even growing up, I would always ask a million questions. I'm not saying I'm the smartest person on earth, but I would always ask questions, and some people would, whether it's professors or teachers or students, they would make it out like, oh, she's so stupid. How come she's asking all those questions? You still don't get that? You know what I mean? And I feel like so I feel like I am not the only one who feels that way. Okay, I feel like I'm not the only one who who has been made to feel. I mean, nobody can make you feel the type of way, but being young and impressionable, especially if you're like 11, 12, 13, and you're asking a question and someone's like, well, why are you asking that question? You should know that already. Sometimes that could put a little, like, you dampen your confidence. And then if you get older and you're in school and someone says that again, that could trigger what happened when you were younger, psychology 101, and you can still feel stupid. So that's my main goal. I want to help those who have been made to feel stupid, okay, because you're not stupid. And for those who ask a lot of questions and then people are looking at you like, why are you asking that question? You should already know that. This video is for you because I am a huge advocate against bullying. Huge advocate against bullying. Huge advocate against people telling people that they cannot achieve something. Because if your dream is to become a nurse, LPN, or RN, you can become a nurse. I want you to realize that dream. I want that dream to become a reality for you. And I want you to reach your goals. And I want to help you along that journey, okay? It's not always easy. I'm not saying it's an easy thing. We all know nursing school is hard. But trust me, if I can do it, you can do it. I'm telling you, if I can do it, you can do it. And so guys, I feel like that's why you guys should listen to me. And also another reason why you guys should listen to me is because I passed Nclex not just one time, but 2 times, and both in the least amount of questions and the least amount of time. Okay, and nobody believed that I could do it. I know it. Nobody believed I can do it, but guess what? I did it because I don't let what people say or think about me deter me from my goals and my success. And I want you guys to be the same way. Yes, I do have some insecurities. Everybody has insecurities, but I don't even let my own self get in my own way of getting to where I want to be. Scrub and Squat says, that's so, I guess, they're aggravating when people do that. But soon as you get your exam back and you got that high B or A, they're looking at you or asking you like, how did you get that? What did you study? That's so true. And you know something, Scrub and Squats, a little secret about me. And I give you guys that advice. Whenever I got my grade back, when I got 100 or 98, like, I never told people my grade. I mean, being, if you're West Indian, you probably know that, like, your parents always tell you, don't tell people your grade, because you don't want people to know and stuff like that. You don't want people to get jealous. But yeah, I never told people my grade. Like, if you think I'm stupid, then I'll let you think that. I'll let you think that I'm stupid. And then when I walk across the stage, and if I have an award, like, that's when their mouth will be dropped open, like, you know what I mean? Because at the end of the day, with nursing school, it's like, it's harder to build your grade back up. Okay, so you always have to stay focused. You always have to fight like you're losing, right? So, but yeah, as soon as you get your exam back, you get that high B, they're asking you, yeah. So then they realize, like, why I was asking that question. Because I know the reason why I ask questions is because I know when I get my exam, when somebody puts the exam in front of me, I'm not gonna have anyone. I can't be like, Jamie, what is the lab value for acute renal disease? Which one is it, BUN or is it creatinine? Like, I know I can't ask anyone that, So that's why I always ask a lot of questions in class, and sometimes people will be annoyed. Scrubs and Squats says, yes. Don't gossip after the test. Yes, and that gossip makes me very, like, especially after the test, it makes me very anxious. I mean, sometimes I would listen and hear when people say, oh, is it A, is it D? And sometimes I would, like, a little bit give into it, to be honest with you, because it makes me anxious. I'm human, but I try not to, like, discuss the test after the test. Gossip about the questions and all that. Yeah, so it could be extremely nerve-wracking, and but you guys know how school is, but eventually you get through it and stuff like that, right? Okay. So yeah, guys, so I want to help you guys pass nursing school, pass boards, and get into nursing school, but one thing at a time, right? One thing at a time. So right now, as you guys may have known or not known, I'm in the process of creating a course for you guys so that you guys can use it as a supplement to help you in your nursing school studies. So basically in nursing school, guess what? I used multiple resources to help me pass nursing school, okay? Rarely did I use, this is a little secret, rarely did I use my teacher's PowerPoints. There, I said it. In nursing school, rarely did I, especially RN school, rarely did I use my teacher's PowerPoints. I'm not saying my teacher was a bad teacher. My teachers were not bad teachers. I feel like I had great teachers, some better than others, but I rarely use PowerPoints. I went to several different resources to get my knowledge, but I understand that could be very, very time consuming. So that's why I'm creating this course for you guys so that you guys have one place, like a one-stop shop to get everything so that it will be easy. So if, like, for example, if you this week you guys are covering assessment of the cardiovascular system, you have to know how blood flows throughout the heart. I'm your girl, I got you, okay? If you guys are going over arterial blood gas values, you want to know the correct pH, how to figure out if it's metabolic acidosis versus respiratory acidosis. I'm your girl, I got you. I'm your girl. I got you. I'll be able to break it down for you guys and be able to be there for you guys and be able to make you guys understand, okay? Because that's one thing that's a passion of mine, is to help people reach their goals. That is a huge passion of mine, is to help people reach their goals and to help people realize their goals, because I absolutely hate when people feel discouraged and when people feel like they can't do it. Because I'm telling you right now, I don't care how old you are, I don't care where you're from, I don't care if English was your second language, third language, fourth language, you can do it, okay? You can pass nursing school, you can do it. Okay, let's see, let's show this. Scrubs and Squad says, whatever you offer for us, whether it's free or selling it, I would definitely buy. I started my OBPs on May 31st, so yes, I need it. Thank you, Scrubs and Squads. Wow, OBMPs. Oh my God. That was my favorite class, by the way. Girl, you're gonna love it. OBMPs is all about us, okay? It's all about women mostly. And peds can be kind of tricky. Peds is like med surge, but for pediatrics, but OB and peds is great. Yeah, I like seeing comments like that. See, comments like that makes me want to work on it all day. Okay, guys. So yeah, guys. So welcome. I know I took like 17 minutes to talk. I wanted to give a long introduction to get more people in the room before I start, because I know once I start in the middle, everybody's gonna be like, wait, wait, go back. But I'm about to start right now, so let's start. I'm gonna share my screen with you guys and definitely ask questions and all that. Okay, so let me try to share it right now. Share screen. Okay, guys. I'm sure you guys may see this now. Actually, let me go get my cell phone to make sure that everything looks good at all times. Okay. Y'all gonna get my bed. Okay. All right. So I'm just gonna have my phone to make sure I'm online at all times. Let's lower that. All right, guys, let's get to it. Okay. Presenter view. Nope. Okay. All right. So actually, let me just, okay. All right, let me just making sure you guys see this. Okay. So good. So making sure I'm online. All right. So KimmyDTV's live first Surg practice questions and rationales. Okay, it says learn how to think like an A+ student and pass Nclex with the least amount of questions. Okay, so this is a live video, so you guys can ask questions as we go along. So this is going to be a brisk review. I think I have like about 11 questions because it took me a while to get everything together and trying to break it down to see how I think. So definitely leave your questions. If you have a question on the rationale, whatever, remember there's no chance to stupid question. This is your chance to ask it, okay? So I want you guys to learn how to think like an A+ student, okay? I'm gonna teach you guys how I think in order for you to get a 4.0 GPA in nursing school, okay? It is possible. And to pass Nclex with the least amount of questions, learn how Nclex wants you to think, okay? So the first question reads, you are working the evening shift, okay? After receiving shift report on your patients from the previous nurse, which patients should you assess first, okay? So you guys are gonna leave your answers down below. A, is it post-op patient requests for PRN IV medication for pain? Is it B, patient who frantically demands the nurse to change her wound dressing? Change it now. Change it now. C, patient who is diaphoretic and shaky. Diaphoretic is another medical term meaning sweating, okay? Sweating and shaking and sweating, okay? D, patient Jamie who says that there is pain at the IV site post placement, okay? So this is how I think. First of all, when I'm looking at this question, especially if there is a word in the question that is capitalized, I see first, okay? So I see the word first. So I know that's something that I should pay attention to, okay? So you are working the evening shift. That part of the question is not really, doesn't really matter. Okay, I'm working the evening shift. Who cares? After receiving shift report on your patients from the previous nurse. So basically what this question is asking you is, which patient needs to urgently be seen, like right now? Like if you don't do something right now, the patient, there will be harm caused to the patient, okay? So A is post-op patient request for PRN IV medication for pain. Okay, post-op patient. Okay, let's see. Scrubs and squats says, she says D. Okay, let's see. She says D. Let's see if it's really D. So yeah, so just to explain to you guys. Okay, post-op patient request for PRN IV medication for pain. Okay, so post-op, yes, the patient may be in pain after surgery and they may be requesting for pain medication. Yes, pain is super duper important in nursing. We want to make sure that your patient is medicated for pain because pain can throw off your vital signs. What are vital signs? Blood pressure, temperature, respirations, and pulse. So yes, after surgery, we do want our patient to be as stable. If the patient does not have pain medication, the patient will not be stable. Their blood pressure may be thrown off. So yes, pain medication is important. We do want the patient to have pain medication, but is it the most important? If the patient does not get their pain medication right now, will will a harm come to this patient right now, like a dire harm? Okay, is it a life or death situation? I like to think of it like this. Is it life or death? So is A life or death? No, it's not life or death. It's very important that the patient gets their pain medication right away because they are post-surgery, but it's not life or death. Is it B, patient who frantically demands a nurse to change her wound dressing? Okay, frantically demands a nurse. Okay, maybe the wound may be having an odor. Maybe the wound may be just really be uncomfortable for the patient, or whatever the case may be. Most patients are frantic a lot of the times. Not saying that they don't have a reason to be, but this is not life or death, okay? If I don't change her wound in the next 5 minutes, like I just walked in to my shift, the patient is not going to die. Is B a life or death situation? No, it's not, okay? Kalisha Davis says C. So patient who is diaphoretic and shaky. Is this his life or death? Okay, so now I want you guys to picture this in your mind. Diaphoretic is a medical term meaning sweating, and shaky. Shaky is a regular term, shaky. So imagine somebody sweating and shaky. Like imagine you're in the bus and you see somebody sweating and shaky, or walking down the street. You could clearly see that this person needs help. If you're driving your car or you're on the bus and you see somebody shaking and sweating, I would think there's something seriously wrong with this person and that this person needs help, okay? So this can be very much life or death, okay? Okay, Scrub and Squats, he chose D. Patient Jamie, who says that there is pain at the IV site post-placement. Okay, yes, I can maybe understand why you put D. The patient can have infiltration, okay? And infiltration is serious too. That means the IV needs to be taken out before, you never know, the patient can have phlebitis, which is inflammation of the vein in there. So yes, you do want your IV site to be clean, intact, with no redness, no swelling, no nothing. But at this very moment, this is not life or death, okay? At this very moment, the life or death situation would be C, okay? Because the patient is diaphoretic, meaning sweating and shaking. So what can the patient have, okay, when the patient is diaphoretic and sweating, okay? I'm gonna put the right answer. Kalisha Davis, congrats, you got the question right, okay? So to go a step further, what can be happening to the patient if they are diaphoretic and sweating? So the patient can have a low blood sugar, okay? And the patient may need glucose right away, okay? Because I remember working in the jail, and I remember one patient of mine, he was a young man, and he would have a unstable oh, great. I'm so happy you got it, Scrub and Squats. He would have an unstable, his diabetes was very unstable. And, if the person is diaphoretic and shaky, the person could go into a coma. That person could be very sick if they are diabetic and their blood sugar is low. The person could pass out. The person could die, basically. So yes, diaphoretic and shaky is the correct answer, okay? So I said this. This is the correct answer. Remember, think physical first. Maslow's hierarchy of needs, okay? So if you guys are not in nursing school yet, or if you guys haven't taken your prereqs, which is one of them is psychology, and they do touch on Maslow's hierarchy of needs. If not, Maslow's hierarchy of needs is basically what is important to the human being. Like, for example, physical needs. Like, physical needs is food, shelter, water, and then safety, and then love and belonging. It's like this whole triangle of needs. You guys can Google that. That is important, okay? So think physical first, okay? For example, who frantically demands that the nurse to change her wounds. That is important because psychologically, the patient's like, oh my God, the wound I need this to be changed because this could be a psychological thing. It is a physical thing too, because wounds do need to be changed in order for it to be clean and for it to heal properly. But diaphoretic and shady is a dire need, okay? So my second point is, which situation needs to be addressed right now? That is something that you guys have to think like Nclex. And the Nclex teacher wants to know that if we put you out, like, forget where you want to work. When you work and when you're taking the Nclex, forget about, oh, I want to work in a clinic, or I want to work in a desk job, or I want to do case management. Forget about that. When you're thinking Nclex, think about this. They are thinking to themselves, if we put this nurse in a med surg floor, okay, well, in Nclex, you could get peds, OV, you get any section more than others. Like, there's no way to tell. But in my opinion, this is how I think of it. In Nclex, they want to say, if we put this nurse in a med surg floor, and will she kill someone? Okay. Will he or she kill someone? Will they be able to critically think? Okay. Will they be able to critically think in order to have the least amount of patient harm? This is basically what they're trying to see. Okay. The last point I said, which situation can wait? You can, the person, especially the frantically demands, you can wait for your wounds to be changed. It is not life or death. A post-stop patient request for PRN IV pen medication. I understand you just came from surgery and you are so important because you just came from surgery, but you can wait, okay? D, patient Jamie who says that there is pain at the IV site post-placement. That's very important because we don't want you to have an infection in the IV. We do not want you to have an infection IV, but you can wait, okay? So that is how I want you guys to think. Which situation needs to be addressed right now? If you don't address the situation right now, this patient can die. That's how you have to think. So when you see the word first, you think, if I don't address this right now, this patient will die. That's how I want you guys to see it, okay? All right. Okay. So we're going to go on to the next question now. Okay, we're going to go on to the next question now. All right, question number 2. I'm going to let you guys read this. It says, patient Melinda was involved in a boating accident and was admitted for observation, okay? As soon as she arrived on the floor, she abruptly means suddenly, all of a sudden, like all of a sudden, unexpected. She abruptly started to complain of severe shortness of breath, okay? Shortness of breath means like they cannot catch their breath, like, okay? So think about it. She was in an accident. She comes to the floor. All of a sudden, she complains of severe shortness of breath, okay? You assess her and find that her vitals are as follows. Heart rate is 150, blood pressure 82/38, and she has absent breath sounds on her right side, okay? Cyanotic, and she's cyanotic. Cyanotic means like blue in the face. Basically, she has signs of having low oxygen in her body, okay? And trachea deviation is possible, so is present. So this is where our anatomy comes in. We know our trachea, our windpipe is there. So trachea deviation is present. Melinda is most likely experiencing what? Is it A, myocardial contusion? Okay, so what is a contusion? Contusion is like, okay, like I had a contusion last summer. I bumped my leg on something very hard and it hurt so, like, for weeks. And I went to the doctor because I thought I probably broke something. And she was like, oh no, it's just a contusion. Just put ice on it and everything like that. So it's fine. So that's what but myocardial contusion, like, obviously worse, because myocardial, when you see the word myocardial refers to the heart. Okay, B, fractured and bruised ribs. Okay, fractured means broken, and bruised, like bruised, blue and black ribs. This is your ribs. C, tension pneumothorax. Is it that? Or D, is it pulmonary contusion? Okay, so we got Claiborne Mathis saying C, Cleisha Davis saying C, Tama Maru saying C. Let's see what it is. Let's see what the answer is. So Claiborne said C. The answer is C, guys. You got it. Congratulations. Woohoo! Okay, so listen. To me, there are certain diseases I already know from certain keywords that it is tension pneumothorax, okay? There are certain diseases, like, you know, when you make your little cute little, well, you guys will see when the course comes out, when you guys make your cute little study guide, study worksheets, if you guys already nurse school and you guys already do that when it comes to like certain diseases and you write down the signs and symptoms, that is one of the classic signs of tension pneumothorax, okay? Remember, tension pneumothorax is identified by hypotension and hypoxia, okay? So when you think about tension pneumothorax, as you guys may see here on the screen, you see the x-ray and how the trachea is deviated. Anytime you see, okay, hypotension means low blood pressure. So you guys know the normal blood pressure is 120/80. So if the normal, sometimes my blood pressure is even 98 over something, but that's because, you know, I'm fairly young and I work out and stuff like that. But 82/38, that blood pressure is extremely, extremely low. Very, very low. Okay. Heart rate is 150. Okay. So honestly, I'll be honest. When I first read this question, I was like, okay, that could be a hemorrhage, because that is, and what is hemorrhage, guys? Hemorrhage is when a person is bleeding out. So usually when a person is bleeding out, like they're losing a lot of blood, because that can also happen in accidents and stuff like that. The blood pressure is low and the heart rate is high, right? The blood pressure is going low and the heart rate is very high because the heart rate is working extra hard to pump that blood. So I did think that, but you know why I thought tension pneumothorax? Because it says, and she has absent breath sounds on her right side. Cyanotic and trachea deviation is present. This is the key, okay? Remember, okay? When you have tension pneumothorax, thorax is basically that tube right there in our chest cavity that helps us breathe. When you see that, you already know that is tension pneumothorax, okay? So right here, I put this cute chart right here. Signs and symptoms is pleuritic chest pain, like in the pleural area, shortness of breath, cough and fever, which is less common. But this is the main thing you guys have to get, okay? Tachycardia. What does tachycardia mean? Tachycardia means increased heart rate. So in order to know what tachycardia means, you have to know the regular heart rate. Regular heart rate is 60 to 100. So 150, that heart rate is beating so fast. So tachycardia, tachypnea. What does tachypnea mean? Anyone know what tachypnea mean? Tachypnea means when you're breathing very fast, like, and remember, when she first came to the floor, she complained of severe shortness of breath. So she's trying to keep up. Hypoxia. Hypoxia means low oxygen in the blood, okay? Absent breath sounds. That means her trachea deviated, okay? And she has hypotension, which is low blood pressure. So this is basically something, I don't want to say memorize, because you don't essentially have to memorize it, but you just this is just a classic signs. Like these just go together. Low blood pressure, high heart rate. Anytime you see the absent breath sounds, cyanotic, trachea, the patient has, but especially that keyword. Your main keyword, guys, is trachea deviation. You know, as soon as you see trachea deviation, I want you to think trachea deviation, tension pneumothorax. Trachea deviation, tension pneumothorax. That is how I always got it when I was in school and when I was in preparing for the Nclex. I know if the patient has trachea deviation, they're already going through tension pneumothorax. Okay, so good job, Claiborne Mathis. Claiborne Mathis got it right. Who else got it right? Cleisha Davis got it right. Tama Maru got it right. And Scrub and Squats got it right. Hey, Scrub and Squats. I'm about to do some squats on my scrubs after this. But yeah, guys, that is the correct answer, right? So just know that. Definitely classic science. You guys are doing a great job, okay? Number 3, we got a dosage calculations question. Quick story. When I was younger, I used to be really bad at math. And the real reason is because I refused to learn my times tables. I just thought to myself, oh my God, how am I supposed to know 100 times tables? So I just refused to know my times tables. I think that's the main reason why. I think another reason why is because, I don't know, I wasn't good at math. And they would take me, I would be one of the students who would be taken out of the class, like while we're having regular like science, English, or whatever. I would be taken out of the class and put into a separate section where all the other students who weren't good at math to learn math, right? I was excellent at all my other subjects, but math was really, really hard for me. And I think apparently it's hereditary, maybe. But it was really hard for me. But now I had to make 100 every quarter. No, the first quarter I had to make 90. And no, the first quarter I had to make 90. And then after that, I had to get 100 on every quarter to pass RN school, okay? So dosage calculations is super duper important. I want you guys to give me the answer to this question because y'all know, if y'all don't know, now you guys know, I have a dosage calculation series on my channel right now, okay? So I have a dosage calculation series on my channel. Check it out. It's pretty good. And I really struggled with math, even dosage calculations before in the past. I struggled with it. I did. But through practice and tutoring, I finally know how to, because my brain just thinks differently, guys. That's why I'm making this review. My brain just thinks differently. It doesn't think like everyone. Some people were just like, they say, oh, this? Let me take out my pen. And then they already got it. I'm like, oh my God, you already got it. Good for you. I'm not like that. You know what I mean? Some people are really good at math. Some people need extra help like me. That's okay, all right? Claiborne Math says, my school requires 100 on every dose calculations too. Yeah, so that could be very nerve-wracking. But guys, the way to get 100 on the dosage calculations is to practice. Guys, when I tell you guys I would practice so much because that's how you reach perfection. Do I agree with them requiring 100 all the time? Nope, because that's not the real world. Well, at least where I work, that is not the real world. But hey, I guess they want to make, you know how it is. All right, guys. So anybody have the answer to that? What is the equivalent to digoxin lanoxin 125 mcg to how many milligrams? All right. So I have a video on my dosage calculations playlist. I have a video breaking down the different milligrams and micrograms. So first off, I would think this question is so easy to solve, and I will show you guys how. Okay, so which one is bigger, milligram or microgram? Better yet, question, which one sounds bigger, milligram or microgram? The word micro means small. Milligram or microgram? Microgram is smaller, okay? So they want you to find the equivalent. So if you have, don't worry if you guys can't see this because the next slide will show it even better. Let's see. If you have 125 micrograms and you want to make it into 125 milligrams, I mean, what would be the equivalent to 125 micrograms? Let's see the answer. So Scrub and Squat says C. All right, Scrub and Squat says C. Let's put her answer up because she was the first person to go ahead and do it. Let's see. What is the answer? The answer is C. Congrats, Scrub and Squats. The answer is C. So how did I get to C? This is the easiest way. Oh, Claiborne Mathis agrees with C. Hey. All right. So this is the easiest way to get it, okay? I said just move the decimal place 3 spaces to the left when you are going from a smaller number to a larger number. And I said, and I also put, sorry guys, what is this? All right, I also said refer to my dosage calculations video. So I do have dosage calculations video on my channel explaining that. But basically the whole premise of this is if you have 125 and you wanted to make it into milligram, if you're going from a smaller to a bigger number, you move 3 places to the left. If you're going from a bigger to a larger number, you may move 3 places to the right, okay? So if they're asking you what's the milligram equivalent to 125 mcg, you're gonna take the decimal place, you're gonna put it at the very end, and you're gonna move 3 places. So 1, 2, 3. And then you put the decimal place here, right? And then, oh my God, this is kind of hard to see, right? Let me get like something close to a marker. Give me 1 second, guys, so you guys can see. All right, so I'm back. So yeah, so you have 125. You have 125 micrograms, right? And you want to turn it into milligrams, okay? So when you're going from a smaller number to a higher number, you always move to the left. So smaller to higher number, move to the left. Move 3 decimal places. Okay, move 3 decimal places to the left. I think I'm going to make a separate course for dosage calculations too, even though I have it on my channel, because I think you guys would benefit from something more packaged and cute and formal. So this is micrograms. So you just take your decimal, see that period, and then you move it 3 places. 1, 2, 3. You put your period there, and then you just put your 0. That's it, baby. That's how you get the answer, okay? So there's no need to do any extra math. You just move the decimal places 3 places to the left. That's all it is, okay? So that is how I teach it because that's how I understand it. I don't want to do no extra math. Oh, can you draw a circle and move it 3 places? Yes, you can. I can. I'm good at drawing. I mean, I good at math. I mean, good at drawing. So see how I combine those two? I combine drawing with the math, and there you go. You don't gotta do all that math stuff, okay? We're gonna mitigate. We're gonna remove as much math as humanly possible, okay? Because we got to get 100 on these dosage calculations class. These teachers are tripping. All right, next question. Number 4. I put that in bold. Your patient has a peak line in the right upper arm and is reporting pain around the site. Pain. When you come in to assess your patient, you notice that the right arm is significantly larger than the left arm, okay? The arm is red and it's warm to touch. Which of the following do you suspect? Is it A, fluid overload? Do they have too much fluid going on in there? Is it B, infiltration? Is it C, DVT, deep vein thrombosis? Or is it D, cellulitis? I'll give you guys a minute to formulate your answer, what you guys think it is. What is the answer to this? Okay, Claiborne Mathis says B, infiltration. Anyone think? All right, I'll give you guys a little help. D, cellulitis is infection. Is an infection. C, deep vein thrombosis is thrombosis means clot. D for deep. Vein is a vein, a clot in the vein, deep. B is infiltration. A is fluid overload. Is it B? All right, we'll see. So I think Claiborne Mathis was the first person to put C. So we're going to put Claiborne's answer up there. No, she put B. I'm sorry. B. He or she put B. Okay, let's see the answer. The answer is B, infiltration. All right. So as you guys may have seen in the cartoon picture, this is what I love. I love to use pictures because that's not the only way I learn, but I'm a very visual person. I like to see my pictures. I like to see pictures with explanation because nursing school is a lot. We have a lot to study. That's a lot to know. But when you have a picture and you could put it into if you can match a picture to a disease or a situation, it makes everything 10 times better and you can memorize it a lot quicker. So that's a tip. So yes, so you will see swelling. You will see cool temperature at the IV site. So basically it's redness around the site, swelling, puffiness around the site, blanching around the site, lighter skin versus the IV site, lighter skin around the IV site. I mean, pain or tenderness around the site, the IV is not working properly. Okay, so that's in a nutshell what infiltration is. So when you look at the question, you see it's not going to be fluid overload. It's not going to be that because of basically the set of because of the keywords that they give you. Pain, okay, one arm is specifically larger than the other. Now you may think DVT, but with a DVT, one leg is with a DVT with a deep vein thrombosis. First of all, you're gonna most likely see it in the legs. If it's gonna be a question on Nclex or nursing school, when you see DVT, deep vein thrombosis, it's gonna be the leg. So one leg is gonna be significantly thicker, heavier than the other. So most likely is gonna be the leg, okay? And you're gonna see, and cellulitis is an infection of the skin. I've seen like some of my patients have it, and sometimes it has an odor, and yes, it is inflamed, but it has an odor, and sometimes there may be pus coming out, and none of that was in the question. So okay, so you see one arm is bigger than the other, So it's going to be B, infiltration. Okay, guys? You guys are doing so well. Next question. Number 5. Your patient comes in with peritonitis, okay? Your patient also, okay, so first, when I talk about peritonitis, okay, when we're talking about the peritoneum, we're talking about this area, okay? The stomach area, okay? This area right in here. So that's peritonitis. Your patient also is experiencing tachycardia, hypotension, and dehydration, okay? So tachycardia, we spoke about what tachycardia is. The normal pulse or heart rate is 60 to 100. If you guys are like, oh my God, why is she repeating that again? La répétition is la mémoire, okay? What does that mean? Repetition equals memory. The more you could repeat something over and over, you will get it. That's good, okay? So tachycardia heart rate is 60 to 100. Anything over 100 is tachycardia. The heart rate is beating fast. The heart is working hard for a reason. Hypotension. What does hypotension means? Means oh, wait, hold on. Tama Maru brought up a good point about the previous question. She said the nurse should elevate the arm because you want to reduce swelling. Very good. Let's put that up there. Thank you, Tama Maru. Thank you. I love when people give great points. That's all in part of the learning. Everybody helping each other. Okay. I think this video definitely has to go up in our study Facebook page. I think I'm going to make a Facebook page. If you guys want a Facebook page, I know I said that before. I'm definitely going to make it this week, okay? Now I got my life together, kind of, sort of. What does that mean? I'm going to make a KimmyDTV Facebook page and to help you guys, okay? To help you guys study and just for academic and career success, okay? So your patient comes in with peritonitis. Your patient also is experiencing tachycardia, hypotension, and dehydration, okay? What other assessment finding would you anticipate as part of your physical assessment, okay? So is it A, nausea, vomiting, and acute onset of jaundice? Is it B, rectal bleeding and increased frequency of bowel movements? Is it C, severe abdominal pain or rebound tenderness? Or is it D, abdominal tenderness in the right upper pain? Okay, so right away, I'm going to let you guys know that I already see the answer. And the reason why I see the answer is because I've seen this question written in several different type of ways, time and again. It's one of those, I don't want to say memorizing questions. Is this one of those things where, you already know this keyword matches with this? But let's see. Okay, let's see what you guys are saying. So Tama Maru says B, which is rectal bleeding and increased frequency of bowel movements. Okay. Scrubs and Scott says it could be the A and C. Yeah. Claiborne Mathis says, I've got this question on a few tests. Yeah. So you see, guys, once you know something, you don't have to keep knowing it over and over again. Because I'm telling you, there's only so many ways somebody can ask a question about peritonitis. I already know what you're asking, right? So because I'm used to taking a million questions, I already know what the answer is because it's in my head now, right? So, So patient comes in with peritonitis. So we already know where the peritoneum is. So we are not confused. We know it's not up here. We know it's not here. We know it's all up in this area, all up in the abdomen area, okay? We know the patient is tachycardia, so the heart is trying to compensate for something. We know the patient has hypertension, low blood pressure, and you know the patient is dehydrated, okay? So there's an infection going on, okay? The keyword, the ending itis. All right. So, oh, scrubbing squats says, I never seen this question. Okay. Well, there's a first for everything. Okay. But you're definitely going to see, it's okay, scrubbing squats. You could guess on this. So let's see. What is the answer? It's severe abdominal pain or rebound tenderness. Okay. So, the peritoneum is a thin layer. What is the peritoneum? The peritoneum is a thin layer of tissue that covers the abdomen and abdominal organs, okay? When this becomes irritated, inflamed, or infected, when you see the word itis, you already know it's infection by either bacterial or fungal infection, life-threatening peritonitis can occur, okay? So that's why I put FYI, this is why a bursted appendix is an urgent issue, okay? So basically, long story short, the peritoneum is your abdomen area, okay? So it's a thin tissue that covers the abdomen and the abdominal organs. So everything in this area is covered by a thin tissue called the peritoneum, okay? So when it becomes infected, like any other part of our body, you will put the itis after it. So if it becomes infected, the patient will get peritonitis. This can happen because of bacterial or fungal infection. So maybe after a surgery, like anything that exposes our internal body to anything foreign, okay? Because you have to remember, everything in the body remains sterile unless, somebody has an accident and their body opens and something enters in it or what have you. So that is basically what peritonitis is, an infection of that tissue covering the abdomen, okay? So the patient, whenever you see that, okay, first of all, they have tachycardia, hypotension, and dehydration because the abdomen, remember, all your abdominal organs are in there. That means the small intestine, the large intestine. What is the function of these intestines? To absorb, right? Those intestines, their function is to absorb fluid, absorb food, absorb nutrition. When that function is impaired because of an infection, that leads to dehydration, okay? And dehydration, like for example, I have been severely dehydrated before to the point where I had to go to ER and get normal saline and everything. And I had tachycardia and hypotension. So aside from peritonitis, you already know the symptoms of dehydration is tachycardia and hypotension because blood pressure, because there's not enough fluid that's circulating throughout the body. So the body is working hard, like, oh my God, there's not enough fluid, then there's nothing being absorbed. That's tachycardia. That's why they always say drink water, be hydrated, because that is so important. Because if you're dehydrated, your heart's gonna work faster because they're like, okay, what's going on? I don't have enough fluid to give to my cells. What's going on? So that's why you have tachycardia and you are hypotensive. Okay, the blood pressure is low. Things are not working the way it's supposed to. Okay, so because the body doesn't have enough fluid to pump out, okay? So you're gonna see severe abdominal pain or rebound tenderness. Now, this is something I want you guys, I don't want to say memorize again, but I want you guys to see this keyword. Anytime on an exam, when you see rebound tenderness, you want to think peritonitis. It's like 99% of the time. Anytime you see rebound tenderness, you know they're talking about peritonitis, okay? So you're going to have, a patient's going to have severe abdominal pain because it's an infection in the abdomen. Whether you have an infection in your tooth, you ever have an infection in your tooth, your teeth is hurting, wherever you have the infection, you're going to have pain because the body is out of equilibrium, okay? So you're going to have severe pain or rebound tenderness, okay? Whenever you see rebound tenderness, like when you press down and it's tender, that is definitely a sign of peritonitis. Rebound tenderness, you're going to think peritonitis, okay? Yes, Claiborne Mathis said, learn this in first semester. Guess I need to review it. Yes, okay. Scrum class says noted. Great. Okay, so D, abdominal tenderness in the right upper quadrant. Anytime you're gonna think that, I automatically think gallbladder. Okay, abdominal tenderness in the right upper quadrant, I automatically think gallbladder. So, you know, abdominal tenderness in the right upper quadrant, that is so specific. We're talking about the whole abdomen there. The question doesn't really give a lot of information that we're really talking about the gallbladder here. So, yeah. B, rectal bleeding and increased frequency of bowel. Now, there's nothing in the question that talks about the bowels and rectal bleeding. There's nothing in the question that talks about that. Yes, Claiborne math says I think B is related to hemorrhoids. Yes, B can be related to hemorrhoids, but there's nothing in the question that talks about diarrhea and stuff like that. But I could understand where you guys coming from because dehydration, because there's more bowel movements coming out. There's like a lot of bowel. Like if you have diarrhea, that can lead to dehydration. That's why they always say like drink Gatorade if you have like diarrhea. I can understand that. And rectal bleeding, of course, because if all that, number 2 is coming out, that could cause the rectal to be irritated and bleed. I can understand that. But however, the main key is peritonitis. Peritonitis has something to do with the abdomen. And A, nausea, vomiting, and acute onset of jaundice. Yeah, so that nothing in the question kind of says it anyway. Nausea, vomiting, and acute onset of jaundice. I can understand that, but the main keyword is peritonitis. When you see the word peritonitis, you're going to want to think about rebound tenderness and abdominal pain, okay? So I put a nice little cute picture here for you guys. When you guys see peritonitis, you say fever. No surprise there. You guys know when there's an infection in the body, the body is going to turn on its defense mechanisms and make the whole body hot so that the bacteria cannot stand the temperature in here and the bacteria can go. So yes, fever will be in it. Racing heart rate, yes, because the heart is trying to keep up with what's going on. Abnormal breathing, yes, because remember we use our abdominal muscles to breathe, and if that is infected, that can be infected. Extreme abdominal pain, of course, is an infection there. Nausea and vomiting, like I said, I understand why you guys would think that, but acute onset of jaundice, it wouldn't be acute, okay? There wouldn't be an acute onset of jaundice, okay? There would not be a acute onset of jaundice at all. Okay, remember, jaundice is a buildup of bilirubin in the blood, is when the liver is not functioning well. Yeah, there's nothing in the question that specifically points out to the liver. Okay, okay, let me see. Claiborne Mathis says Bloomberg sign, rebound tenderness, and yeah, exactly. Bloomberg sign. Oh, let's put that on the screen. Claiborne Mathis, yes, that's a good point to put out. Claiborne Mathis says Bloomberg sign, rebound tenderness. Bloomberg sign, rebound tenderness and peritonitis go hand in hand. Yes, very true. There are certain things that just go hand to hand. So rebound tenderness, peritonitis, rebound tenderness, peritonitis, rebound tenderness, peritonitis. I'm such a goofball. Diarrhea. Yes, that could happen. Constipation. Okay. So you guys don't have to memorize it like, oh, like you don't have to write down, like memorize. Oh, okay. Signs of peritonitis, constipation, diarrhea, nausea, vomiting. You don't have to memorize that. Just know that. I remember I was listening to Mark Klemek, especially if you have a select all that apply question. If it's affecting the abdomen, don't you think they will have nausea and vomiting? Yes, because that's part of the GI system. Don't you think they will have constipation? Yes. You notice that constipation and diarrhea is different, right? But it all affects the abdomen. So it's not a surprise, Yes, that part threw me off. Let's see. Let me see. Yes, that part threw me off. Claiborne Math says, my main problem is not spending enough time thinking about a question. I end up missing it. Yeah, I know. You know what, God? I understand Claiborne Math is. When I was taking the Nclex, I do not, and I repeat, I do not advocate for this, but I basically, I had to remind myself several times, Kimberly, slow down, because, you know, it was just a lot of pressure. I was like, oh my God, I got to pass Nclex because I want to get out. I got to do this, I got to do that. And, you know, a lot of times you got to slow down with the question and really read it. And other times you can't read too much into it. So the main key is to practice as much question as possible. That way your brain is used to thinking like how they want to think like, and you won't read too fast and you won't read too slow, okay? But yes, Claiborne Mathis, good points. How come this is not, okay. All right. So let's go to the next question. All right. Next question. Oh, I was wondering why I wasn't doing that. Okay. Your patient has C. diff, Clostridium difficile. Your patient's family member is in a rush to leave to go to school and ask you what is the quickest and safest way to clean her hands. Everyone, I hope you guys get this question right. But if you guys don't get this question right, it's okay. It's okay. Don't you feel bad if you get this question wrong. Nah. Don't you feel bad. Or I'll be over there knocking on your door. Okay. Which instructions would you include? Okay, so which instructions would you guys include? I'm gonna give you guys a moment to answer this question. What is the question to this answer? Your patient has C. diff, and your family member is in a rush to leave to go to school because they don't want to fail this test. They're in nursing school. What is the quickest and safest way to clean her hands? What would the safest nurse do who's supposed to protect her patient and society in general? All right. So Claiborne Mathis put B. Let's see what the correct answer is. Is it hand hygiene with sanitizer and water? Is it hand hygiene with soap and water? Is it hand hygiene with hand sanitizer? Is it hand hygiene with bleach wipes? Get that C. diff out. Yeah! The answer is hand hygiene with soap and water. Good job, Claiborne Mathis. Okay, so I put this. Remember, okay? Always use soap and water when your hands are visibly dirty, after using the bathroom, before eating or touching food, and after diseases that cause diarrhea, meaning C. diff, norovirus, and rotavirus, okay? So this goes into the safety, like you guys probably will have, I think I maybe had one question on like contact precautions, certain kind of precautions. Yes, Tama Maru got it right too. She put B. So I put this little cute picture again. Like I said, pictures are everything. So clean their hands, including before entering. Remember, contact precautions. Patients who have contact precautions, there's like a list of different diseases that require contact precautions. One of them is C. diff. Okay, C. diff is found in the stool. So the patient has contact precautions. So everybody on contact precautions, they must clean their hands before and entering and when leaving the room. Okay. You also must put on gloves before room entry. Discard gloves. So put on gloves before you enter the room. Discard gloves before room exit. Remember, you guys, make sure you remember that, because that could be into a question too. Do not wear the same gown and gloves for the care of more than one person. Use dedicated or disposable equipment. Clean and disinfect reusable equipment before use on another person. And that's from the CDC, okay? So hopefully 9 times out of 10, they're not doing a reusable equipment, but hey, sometimes you never know. Good job. Okay, next question. You are caring for an alert and oriented patient who is terminally ill and has a DNR on file. DNR means do not resuscitate. Resuscitate meaning like try to bring try to bring the person back to life, meaning initiating CPR. Okay, the patient suddenly arrests and the family insists that CPR be initiated. How would you respond? Okay, so just for my people who may not understand, terminally ill, meaning the patient is about to die. The patient is sick and on their last, on their last legs, they're going to die anytime soon. DNR is a do not resuscitate order, meaning like if the patient knows that they are sick and they wish, like if they stop breathing all of a sudden or they start to give out and they don't want anyone to try to save their life. They don't want any CPR. They don't want nothing. So in this question, the patient suddenly arrests. They suddenly have an arrest, a cardiac arrest. Their heart is about to fall out. They're about to die. They're actively dying. And your family member insists that CPR initiated. How would you respond? What do you guys think the answer to this question is? Would you imagine somebody in front of you is actively dying, okay? They're actively dying. But you know that they have a DNR in file, do not resuscitate. And the family, okay, the patient's family, mother, sister, brother, cousin, daughter, son, insists that you start CPR to try to save the patient life. How would you respond? Would you A, call the provider to clarify the status order? Okay. Would you B, secure the cart and call a code stat? Would you C, and call a code, meaning like call code blue and everybody's gonna come and try to save the patient? C, inquire with the charge nurse on the next course of action. Hey, charge nurse, what's the next action? Or D, honor the patient wishes and DNR status. Okay, so hey, the shopping woman. So the shopping woman put D. Okay, Scrubs and Squats put D. Hamlet put D. Claiborne Mathis put D. So let's see, what is the correct answer to this question? Good job, guys. The answer is D. Honor the patient's wishes and DNR, okay? What is a DNR? A DNR, thank you, the shopping woman. A DNR is a legal document written by the physician instructing healthcare providers not to perform CPR, okay? So that's basically what a DNR is, a legal document. It's a legal document that the physician, the provider wrote up so that the healthcare providers, meaning nurses, okay? So why do patients choose, okay, so you may ask yourself, oh my God, that's so horrible. Just out of curiosity, why do people choose a DNR? So some reasons is because sometimes the patient knows that they're about to die, okay? And another thing is quality of life, okay? They know that their organs are damaging. Some people rather die than, some people rather die. They don't want to rely on a machine to live because they know that they are going to die, all right? So when it comes to questions like this, you don't want to put your own ethics, morals. Nobody cares about, no, I'm gonna be honest, Nclex nursing school doesn't care about your ethics and morals. They just care that you know the law, that if there's a DNR in file and you perform CPR because a family member, you're going to get in trouble, okay? Now, I'm going to switch up the question. What if the question read, the patient suddenly arrests and the patient insists that CPR be initiated? So let's say the patient is arresting. They're in cardiac arrest. And the patient says, wait, I want CPR to be performed on me. What would you do? But they have a DNR in file. So legally, there's a document in their chart that says they have a DNR. They have a do not resuscitate, but they physically tell you with their mouth, I want CPR right there at this very moment. Do you perform CPR or no? And that's the patient themselves. Let's see. Scrub and Squat says, doing chest compressions can do more damage than good, especially when they know they are going to die no matter what. Claiborne Mathis says, you can do it. Okay. Anyone else? Scrub and Squat says, you would have to grant that patient's wishes. Okay, very good, guys. You got it right. Woohoo! Yes. So if the patient themselves say at the last second, hey, I know I have a DNR. They may not even say I know I have a DNR file, but I want to be saved. Yep, very good. Yeah, very good, the shopping woman. You have to do I'm sorry, guys. If they wish to be resuscitated in the last minute, you have to resuscitate them. Okay. Next question. Okay, I said part 2, let's search questions review. All right. Number 1. Clubbing of the fingers is most likely associated with, is it A, acute rheumatoid arthritis? Is it B, chronic oxygen insufficiency? Is it C, chronic multiple sclerosis? Or is it D, acute onset diabetes? Okay, so in order to know what this answer is, you have to know what clubbing of the fingers is. Clubbing of the fingers. So let me let you guys answer this question first, and we'll see who gets it right. Oh, I'm so sorry, guys. I didn't even share my screen. Let me share my screen. Share screen. Yes, Tamamaru. Well, I mean, yeah, you would start CPR right away. You wouldn't say, I don't know if you meant that, but just in case, you wouldn't say, hey, you have to sign this consent. You would start it right away if they ask you. All right, so for the next question, you guys all got it right. Scrubbin Squat said B, the shopping woman said B, and Claiborne Mathis said B. You guys are right. Chronic oxygen insufficiency. Good job, guys. So I put a picture of clubbing of the fingers so you see what it is. It's basically a symptom of a disease. It could be heart or lung, which causes low oxygen levels, okay? Because, you know, the heart transfers deoxygenated blood from the lungs to oxygenated blood, okay? I think I'm going to make a video of, like, blood flow through the heart. Now, I think I will. And you guys will understand more of how the heart and the lungs basically work together to make sure that there is oxygen in your body, okay? So give it up for the heart and lungs. Thank you, God. All right, so clubbing of the fingers. That's how it looks like. Okay. Next question. Your patient develops acute slurred speech. So what does the word acute mean? Like sudden. It's not chronic. Chronic meaning over time. Acute slurred speech altered LOC. LOC means level of consciousness. That means if someone's alert and then now they're like this, like if my level of consciousness is alert right now, but if I'm sleeping, my level of consciousness is not alert. And left-sided hemiparesis, okay? So hemiparesis, when you see the word hemi mean one-sided, paresis means weak, okay? So if they put the left-sided in there, that means the left side is weak. You would most likely suspect what? I want you guys to put the answers down below. Let me see what you guys' answers are. So remember, your patient develops acute slurred speech. So all of a sudden, what is slurred speech? Slurred speech is, I'm not making fun. I'm being very serious because it's a serious thing. Slurred speech is like this. The speech becomes slurred and low, alter level of consciousness. They're not fully alert, and left-sided weakness. The left side becomes weak. What would you suspect? Let's see your answers. Let's see your answers. Okay. Okay. All right. Okay. Y'all are smart. You guys are smart. You guys are smart. Well, even if you got it wrong, you guys are still smart. You want to know why? Because you're a watcher of KimmyDTV. And I'm sprinkling all this smartness into you right now. Okay. So, so Scrubs and Squats says B. Tama Moru says B. Tama, I think that's your name, Tama. I think that's how I pronounce it. Claiborne says, not sure, but I think it's B. The shopping woman says B with a question mark. And Tyru says B. Let's see the right answer. Let's see the right answer. Let's see the right answer. Correct. The answer is right hemisphere, meaning the right part of the brain, CVA, cerebral vascular accident. Okay, so let's break down that word, okay, because I want you guys to always get it. Okay, so there are certain keywords that you guys have to know here. Okay, first of all, in the question, you have to know LOC means level of consciousness, so it's altered. And left-sided hemiparesis, when you guys think hemi, always think one side, because you're gonna see this word come up again. I mean, this prefix of a word come up again and again in nursing, and it's basically medical terminology. You want to think half. And paresis, when you think the word paresis, you're gonna want to think weakness, not paralysis. Paralysis means can't move at all. Paresis means weakness. So left-sided weakness. So why is it? Oh, thank you so much. I forgot all about that. Scrubs and Squats says, y'all do my girl a favor and like this video. Yes, guys, like the video. I forgot all about that. Like. Okay, so I feel so special. Okay. So why is it right hemisphere cerebral vascular accident? So what is a CVA? CVA, cerebral, you want to think head. Okay, cerebral, you want to think head. Don't think about my head, because my hair need to be done. But cerebral, you want to think head. Vascular, meaning the vessels in the blood, accident. Okay, so cerebral vascular accident is basically okay, so obviously there's blood flows through the entire body. There's blood flow in the brain. There's like specific different types of blood flow if you guys know anatomy. But for the simple explanation of this question, okay, so there's blood flow through the brain, right? If there's a disruption in the blood flow to the brain, that is what you call a cerebral vascular accident. That can happen for several reasons, especially if there is a clot in the brain. So if there's a clot in the brain, then like, so let's say everything is going right, but then there's a clot in the brain. That means no blood can go through. It's like if you're combing your hair. Let me give you an example. I'm combing my hair. I don't have a comb, but I have a brush. And then there's a knot in my hair that's preventing the brush from going down. That is the same way when it comes to blood flow throughout the brain. There could be a clot that prevents the blood from flowing through your brain in order to provide the whole brain with oxygen. Okay. And what is the brain is the master center. Okay. Your brain is so important. Your brain is what makes you see, hear, talk, walk, everything is in your brain. So that is why you have that altered level of consciousness. Okay, that's why you have that left side hemiparesis. Okay, so but CVA is basically another word for a stroke. Okay, but I just wanted to explain to you guys. Okay, you could also have a hemorrhagic CVA, meaning there could be a hemorrhage, there could be too much blood flow, there could be a blood vessel that breaks in the brain, and the brain is filled with a lot of blood, like there's so much blood everywhere, and that can also disrupt the brain from working correctly. So you're going to have an altered level of consciousness, because think about it. The function of the brain is to help you function. How am I awake? By the grace of God. After God created my brain so that, not to be religious here, it's not a religious channel, but create my brain so that I can be alert. Okay, so my brain is allowing me to be alert right now, allowing me to talk, allowing me to speak, and allowing my body to move. Okay, but if there is a CVA, a cerebral vascular accident, okay, and here's the funny thing about the brain, right? Let's say this is the brain, right side, left side. The right side of the brain control the left side. The left side of the brain control the right side. So, okay, if there is left side hemiparesis, if there is weakness in the patient's left side, then there is a CVA on the right side. That's all you guys have to know about that. Okay, if there is a CVA on the left hemisphere of the brain, there is going to be right-sided hemiparesis. If there is CVA on the right side of the brain, there's going to be weakness in the left side of the body. Okay, so that's the main thing you have to understand. The right side of the brain control left side of the body. The left side of the brain control right side of the body. That's it. Okay, so I already knew from these from these keywords, that this is a CVA, that this is a stroke, because this is classic signs of the stroke: slurred speech, altered level of consciousness, and left side hemorrhages. Another thing you can see is facial drooping, one side of the droop. And this is very important for everyone to know, even if you're not a nursing student, because if you see someone presenting those signs, you have to call 911 right away so that they can take a specific drug. I forgot the name of it. If you guys remember, you could leave on the comment down below. It's like a clot buster, but it must be given within, I think, 2 or 3 hours. That's also on the Nclex. But you want to call 911 every way. I think it's important to know in general. If you see somebody having those signs, you have to know it, okay? So that is why it's right hemisphere CVA, okay? Any questions, guys? Please leave it down below. A, CVA in the brain stem? No. No. C, bacterial meningitis. I can understand why you might think it's bacterial meningitis, but this is very specific. It says left-sided hemiparesis, acute slurred speech, and altered LOC, okay? D is left hemisphere CVA. Now, it wouldn't be a left hemisphere CVA. Why wouldn't it be a left hemisphere CVA? Why? It wouldn't be a left hemisphere CVA, because if it was a left hemisphere CVA, meaning if the stroke was in the left side of the brain, you would see the question read right-sided hemiparesis. Because remember what I said, left hemisphere CVA, right-sided weakness. Right-sided hemisphere, left-sided weakness, okay? Okay, so Tama says the condition can cause congenital problem, trauma, tumors, or stroke can cause motor skills. Oh, I think I missed what she was referring to. Oh, I see what you're saying. Yeah, stroke can cause a lot of stuff to occur. Uh-huh. The shopping woman says, so tell us more on how to break down two possible answers, please. Okay. All right. That's what the shopping woman said is, oh, that's true. Before I answer your question, the shopping woman, I want to point out what Claiborne Math says. That's so true. Okay. Claiborne Mathis says that C is wrong because a key sign of bacterial meningitis is stiff neck and fever. Yeah, so that's another memorize. So bacterial meningitis, when you see the stiff neck and the fever, you already know it's bacterial meningitis, okay? So let's go back to the shopping woman question. She put, let's see, what did she put? She put, so tell us more on how to break down two possible answers. Okay. So I don't know if you're talking about this specific question or questions in general, but when you come down to two possible answers, it depends on the question. But in general, what you want to think about is which answer is most safe. Okay. In general, especially when it comes to Nclex and nursing school, you want to think about which question oh, okay. The shopping woman says in general. So yeah, you want to, when you have two answers and you're like, oh my god, they look so good, both of them look so good, and first of all, if I see two answers that's most like that looks really good, the first thing I would think about is, okay, let me think through this question. Let me think through the pathophysiology. What is the disease process? Okay, what is the question asking me? Like, for example, one of the first questions we answered is, which patient would you see first? So life or death, right? If I could only do one thing, and this is always a good thing. I remember there was a tutor that said that if you could do only one thing and you can't do anything else, what would you choose? Okay. So that is another way you could answer two questions. Like if you do B, if it's between B and C, for example, if you do B, that means you cannot do C. That means the patient is depending on you. That's another way. Another way is which answer is the most safest for the nurse to do, like which one is the most safe. And yeah, but it really depends on like how the question is being asked. Like if it says which one is first, or like for example, this question you would most likely suspect. For this question, like how Scrub and Squat says, let me put her answer there because that's so true. Scrub and Squats made a good point. She's like, honestly, knowing a medical term in A&P is the only way. Yeah, for this question, in a way, yeah, some questions you have to know. You're welcome, the shopping woman, or having a good idea. Yeah, but honestly, guys, with this question, it's all about knowing, like it's basically knowing the classic symptoms of a CVA. And yeah, having a good idea is an important thing. But you know how you have a good idea? When you keep doing questions and you know your content, okay? All right, guys, thank you so much for your questions. Thank you, the shopping woman. All right, so I don't know, this is a little chart I put, and this is one chart that I looked at, which I find really good. this is basically a difference between right brain damage and left brain damage. So when this video goes up, you guys can pause it and like read through it. Like I said, you don't have to memorize it. Like, oh my God, I'm gonna memorize it, but read it. Okay, read it once or twice and know it. Like for example, right brain damage, they could have paralyzed in the left side, hemiplegia, because remember I said right and left. Left-sided neglect, because if it's in the right side of the brain, everything's in the left. Spatial perceptual deficits, tends to deny or minimize problems. And I saw these kind of questions in the Nclex and nursing school questions, like they rapid performance, short attention span, impulsive, safety problems, impaired judgment, and impaired time conception. So when the patient has a CV in the right side of the brain, they're kind of like, I don't want to say in denial, they're not in denial, but they minimize their problems, they're impulsive, they have impaired judgment. I don't want to say like a drunken person, but kind of like a drunken person. Like they don't know, they're like they have an impaired judgment, like they do what they want. But on the left side, they're actually aware of their deficits. Okay, they are more depressed, they have anxiety, they have slow performance, they're cautious, impaired right or left discrimination, impaired speech and language, aphasis. Of course, they're paralyzed. So in the left brain, you could think of it like the left side of the brain. If they have a left-sided stroke, they are more aware of what's going on. So that could bring about a lot of depression and anxiety. And they have impaired speech and language, and impaired comprehension related to language and math. Whereas the right side of the brain, you could think of it like this: oh, that's the right way to be like ignorance is bliss, right? Because they're impulsive, they tend to deny their problem or minimize their problem, safety problem. So that's a fun little way to memorize it. Like right side of the brain, like, oh, that's the right way to be because ignorance is bliss, and they're impulsive and they have safety problems, but it's like a young teenager, right? So that's another way to look at it. All right, so let me see what you guys are saying in the chat. Claiborne Mathis says, I try to prioritize the answer choices. If I narrow it down to, like Kimmy says, ABCs always are on my mind too. Yes, that's true. That's a good point. Scrub says, right. Claiborne Mathis says, if it's a question like the last one, I just try to remember key points from my notes. Claiborne says they like to put 2 interventions that must be done, but there's always one that you must do first. Yes. And that's another good way to look at it. Like, if you could only do one, which one would you do? And I try to prioritize the answer choices if I narrow it down to 2. Yes. It's all about priority, guys. At the end of the day, like, they know, right? Nursing school, Nclex, they know that you have to, for example, raise the head of the bed up and apply oxygen to a patient that is severely hypoxemic and shortness of breath. But if you could only choose 2, this is a good example. Raise the head up. If they ask you which one would you do first, raise the head up of the bed, or like let's say the patient is lying supine meaning just down. Would you raise the head of the bed first, or would you apply oxygen first? Which one would you do first? So that's an example of one of a question would you be stuck in. The answer would be, what would you do first is raise the head of the bed, because you want to make sure that there's adequate airflow, airway, breathing, circulation. Okay. Like Claiborne Mathis says. And then you're going to apply the oxygen. But most people will think apply the oxygen first. Yeah, applying the oxygen is important. But what do we need in order for oxygen to work throughout the body? We need an airway. We need a tube. We need a pathway for the oxygen to reach it. So it would make sense to raise the head of the bed first. If the patient's laying like this, raise the head of the bed first. Then you apply the oxygen. Then the oxygen will circulate to the body better, right? That's the question I just put up on the top of my head. Came up. Okay. Next question. I think we're getting to the end, right? Yep, we're getting to the end. I think I'm gonna stop at like 3:50. It's 3:43 now. And then next Sunday we will continue. Okay. So, which of the following medications should be questioned by the nurse if ordered by the provider to treat a patient's complaints of nausea and vomiting? Okay. So, this is a pharmacology questions for those of you guys who love pharmacology. Woo woo. Not I. Which of the following medications should be questioned by the nurse if ordered by the provider to treat a patient's complaint of nausea and vomiting? Okay. So we got famotidine Pepcid, promethazine phenergan, prochlorperazine compazine. Without Googling it, what is the answer? Now, Claiborne Mathis, reread the question. Make sure you, because I got this question wrong, actually, the first time I saw it. But then I reread the question and I got it. What is the question asking you? And what do you have to know? Scrub and Squat says hate and love for farm. I got the question wrong not because I didn't know what the medications were, but because I was such in a rush to read it, I didn't really understand what it was asking me. Okay. Scrub and Squat says A. Shopping Woman says A. Let's see what the answer is. Okay. So before we see the answer, oh, Scrub and Squat is a farm tech. Hey, that's cool. All right, so it says that's really good, actually. That's really good. You have a lot of advantage. Claiborne says, I see. Okay. So it says, which of the following medications should be questioned by the nurse? Whenever you see the phrase be questioned by, that means it's wrong. That means it's wrong. That means something is wrong. That means between this foundation and this foundation, which one should be questioned? I think this one, because this is definitely not my color. So question means is wrong, okay? If ordered by the provider to treat a patient's complaints of nausea and vomiting, okay? So you know the provider is prescribing something for nausea and vomiting. So which one would you question? Yeah, it's okay, Claiborne. I did the same thing. So let's see, which one is the answer? I got that question wrong too. Y'all laughing? Y'all laughing? Ah! The answer is A, famotidine. Okay. Famotidine Pepcid is used to treat ulcers and GERD, okay? So I put this reminder here in a little box. I said, I want you to ask yourself, because I got this question wrong. Yes, KimmyDTV, I got this question wrong. It says, what is this question really asking me? If you're reading this quick, because it says should be questioned, I'm just like reading it fast to treat. I would just think, oh yeah, I already know phenergan treats nausea and vomiting. The question is asking you which one does not treat nausea and vomiting, okay? So you guys want to see exactly. The shopping woman says, okay, the shopping woman says it's about that foundation not matching. Very important. Yeah. And the thing is that sometimes we do match, right? Like before when we were answering the question about peritonitis and some people saw rebound tenderness, peritonitis. Okay, that one is match, or trachea deviation, no breath sounds, shortness of breath. That was, which one was that? I think tension pneumothorax. That was something. No. Go back in the questions and you guys will see it. That was something match. So some questions are match, but don't always think in your head, oh, match. Some questions are not about match. Like the shopping woman says, that foundation is very important. Like always remember to go back to your roots. We get very excited when we see a matching question, like rebound tenderness, peritonitis. But some questions like this one, you may know every single drug and what it does and still get it wrong because you're not answering the question. Okay? But even if you don't know every you're not reading the question. But even if you don't know what every medication means, you could kind of guess it, okay? So you also have to ask yourself, what are these medications prescribed for, okay? So I just put the definition of this. So famotidine Pepcid is used to treat ulcers and GERD. I know that because I was prescribed that one time. I don't think it works for me, but hey, I just had to change my diet, and that's what cured my GERD. Promethazine phenagrin treats nausea and vomiting, and it's also associated with travel sickness. I just put that in there. Prochlorperazine compazine treats severe nausea and vomiting, and trimethylbenzene Tigan treats nausea and vomiting, and Tigan is also commonly used after surgery or certain intestinal problems. So I knew some of these drugs honestly because I was an LPN. You guys don't have to like write it down, and I mean you could write down if you want to, but you guys don't have to like necessarily memorize it, because you know some of these drugs, like the more you see it, the more you know. But just know prochlorperazine compazine, it treats severe nausea and vomiting. Phenergan, nausea and vomiting. Tigan, nausea and vomiting. But you know something looks different here. Even these promethazine, prochlorperazine, I would think they're all with the parazinazine. They look kind of similar to me. They must do the same thing. All right, that's not all the time, but I'm just saying with this question. And Tigan, that's kind of different. But for famotidine Pepcid, I know for sure it's for GERD. So you would question that, because famotidine Pepcid is used to treat ulcers and GERD, not nausea and vomiting. Absolutely not. Okay. Next question. A patient has just been diagnosed with acute renal failure. Okay. So what does acute mean? All of a sudden, not chronic. Chronic means over time. Acute renal failure. What does renal mean? Renal is a medical terminology for the kidneys. What does the kidneys do? They clean out the system. They help you urinate. When you urinate, you all urinate all those toxins, all those bad stuff. That's why they say drink a lot of water so you can urinate all your toxins out. Okay. It says, which laboratory tests would the doctor most likely have used to diagnose acute renal failure? Okay. Patient comes in with kidney failure. Okay. So A, is it bilirubin and ammonia level? So as you see bilirubin, I want you to think about jaundice and the liver not functioning. Okay. So bilirubin, we already know, if y'all like to do match, bilirubin, jaundice, liver. No, we're not talking about the liver here. We're talking about renal. Renal means kidney, okay? And ammonia level. B means white blood cells and hemoglobin. C, potassium and sodium. D, BUN and creatinine. So what would the doctor use to diagnose acute renal failure? All right. Looks like you guys are getting it. Scrubbers Class says D. Shopping Woman says D. Claiborne Mathis says D. Everybody's saying D, D, D. Okay. So this is actually going to be our last question. Okay, guys. Wait, let me see if this is the last one. Yeah, this is going to be our last question. And then we'll just do another set next week. Okay. So the correct answer is D. Yay! The correct answer is D, which is BUN and creatinine. Okay. So BUN shows the balance between the production and excretion of urea. Urea is basically toxin in the body. And creatinine is the most significant in diagnosing renal failure. It determines renal clearance. Okay. So if you would see, if it was written in a different way and you would say C, it says BUN, and D says creatinine, I always remember this. Remember to choose creatinine, okay? So BUN and creatinine, yes, but creatinine more than BUN, because creatinine determines the renal clearance, okay, guys? So remember, bilirubin has to do with jaundice, and jaundice has to do with liver. That means the liver is not doing right, okay? And white blood cell, the doctor would usually order labs to check the white blood cells if they suspect like an infection, because if there's an infection, the white blood cell count will be elevated. Elevated means like it would be high, so you would have to know your normal values for white blood cells. Hemoglobin, that has to do with the blood. In a sense, yeah, that has to do with the kidneys. But I'm not gonna go into that because I don't want to confuse you guys. Potassium and sodium. All you guys have to know for this question is that for renal failure, you're gonna want to choose BUN and creatinine. Okay. I know I said I would. This is the last one. Okay, we're gonna do one more. One more is gonna be the last one. One more. This is so fun. Guys, I used to be like so obsessed with taking questions. I was like so obsessed. All right. Number 5. The nurse is caring for a client who has taken his regular insulin approximately 1 hour ago. Okay. Suddenly, he presents with tachycardia, jitters, and palpitations. So, what is tachycardia? Tachycardia is fast heart rate. Okay. Yeah, it is fun, scrubs. Is fast heart rate. Okay. So the normal heart rate is 60 to 100. Anything above that is tachycardia. Heart is beating fast for a reason. Jitters, jittery. That's what it is. I don't even have to say the definition. This is jitters. And palpitations. Heart is beating fast. Like what happens to me when I drink coffee. That's why I don't drink coffee. What would be the correct intervention for the nurse to take? Is it A, check blood glucose level and administer carbohydrates? Is it B, give nitroglycerin and perform EKG? I don't know. We have some heart palpitation. Maybe they need some nitroglycerin. Maybe we need to check the heart since they're having heart palpitations, right? C, call the physician for additional insulin order. D, restrict salt. Okay. What would be the answer? Now, when I'm saying these things, I'm not trying to confuse you guys. I'm just trying to give those explanations because I understand how some people may think or how I may think sometimes. You may think to give nitroglycerin and perform EKG because if you guys know, nitroglycerin is a medication for the heart. We typically give it when they have a myocardial infarction. So, and perform EKG. Well, anytime a patient comes with heart issues, they're going to perform an EKG. Okay. Oh, you don't know? Okay. All right, that's okay. So I want you guys to, okay, I'm going to say C. Okay. Remember, the patient just got regular insulin. Okay. What does insulin do? Insulin brings down the blood sugar level. So automatically, I already know we're dealing with a patient who has diabetes. Okay. So the physician orders regular insulin. So the client took his regular insulin approximately 1 hour ago. Suddenly, all of a sudden, he has tachycardia, jitters, and palpitations, and he just got his insulin 1 hour ago. Right? He just got his insulin. A patient who has diabetes just got his insulin 1 hour ago. Now his heart rate is increasing. He has palpitation and he's shaking. What would the correct intervention for the nurse to take? What would you do? If you could only do one thing, okay, because I see some different answers. I see C, A, and D. If you could only, but remember, guys, before you choose your answer, you could only do one thing and you can't do anything else. That means if you do one thing, you can't do anything else. And then whatever happens to the patient happen. Okay? So imagine right now somebody in front of you shaking, jitters, their heart is beating fast and they're having palpitation. Nurse, what would you do? See it like that in your head. What would you do? You know you just gave this patient insulin 1 hour ago, and suddenly they come up to you like, nurse, they have palpitations. Their heart is beating fast and they're jittering. What would you do? One thing you can do, and you can't do anything else. Okay. This is the right answer. The answer is A. Check blood glucose levels and administer carbohydrates. Why would you do that? So, I like to say this is another matchy match answer, okay? This is basically the symptoms for low blood sugar, okay? Shaky, sweaty, dizzy, sweaty. We'll use diaphoretic because since we're in the medical world. Okay, dizzy, confusion and difficulty speaking, nervous or upset, headache, weak or tired, hungry. Okay, so Scrubs brought an excellent point. Squats and Scrubs says, okay, that makes sense, but why carbs? Can anyone answer why we would give a patient like this? Because obviously we gave them insulin, right? We gave them insulin, regular insulin an hour ago, and now all of a sudden they're shaking, they're jittery, they have heart palpitations. So we already know, let's establish this. We already know that this patient is presenting symptoms of hypoglycemia. Okay. Anytime you see a question like, they don't even see this patient has diabetes, but you already could tell they have diabetes because they're taking insulin. But if you already see that this patient has diabetes and they're taking insulin, okay, and they present to you with tachycardia, jitters, and palpitations, automatically know that these things are symptoms of hypoglycemia. And these are other symptoms of hypoglycemia. They're nervous or upset. They may have a headache. They may have weak or too tired. This is what we would do. Like I said, I had such a distinct patient in the jail 2 years ago. He had all those symptoms. Like as it progressed, his personality changed. He got nervous and upset. He looked weak and hungry, weak and tired. He was dizzy. He had all these symptoms actually. Okay, so you already know, you will know that when you see a question like this, that this patient has hypoglycemia. Okay, so we have established that. If you don't know, please ask the question. You already know that they have hypoglycemia. Okay, so if they have hypoglycemia, Tama, we would not call the physician for additional insulin order, because insulin will bring the blood sugar even lower. It will bring it even lower, okay? Because that is what the question is telling you. Because, okay, diabetes, okay, quick overview of diabetes. Oh my God, I can't wait for my course, guys. You're going to love it. Quick overview of diabetes. Diabetes, first of all, it's very broad actually, but for the purpose of this question, there's multiple types of diabetes. Diabetes insipidus, mellitus, but we're talking about regular diabetes mellitus. Diabetes is basically when there's a lot of glucose in the body. Like for example, if I eat a cracker right now, if I eat McDonald's, like whatever I eat, if I eat a cracker, if I eat bread, sugar is entering my bloodstream, right? And then insulin is naturally produced by the body to take that sugar that's in my blood right now, because I just ate that cracker, put it into my cells so that I can use it for energy, right? But what happens in diabetes is that there is either no insulin at all or not enough insulin to take all that sugar that's in your blood right now to pull it into the cell so that your body can work, right? So what happens? That means the blood sugar is high, and that's not a good thing. That can make you sick. The blood becomes very sweet, and it becomes very very copious, very thick. So that's a problem. That's why a lot of people who may have diabetes, can have circulation issue. The blood can't circulate correctly. They are at risk for infection and stuff like that because there is a lot of sugar in there, right? There's a lot of sugar in their blood. That's why they can either be on medication if they have like type 2, or they could be on insulin if they have type 1. Type 2 can have insulin too, but the insulin basically takes all that sugar, pulls it back into the cells so that the body can actually use that piece of bread that you use for energy instead of letting all that piece of bread hang out in the blood like that, if that makes any sense, right? So, however, this client had insulin and now they have tachycardia, jitters, and palpitations. That means that insulin brought that blood sugar way too low. Okay. That's why I always like question people who say, oh, I'm going on a no sugar diet. The brain needs sugar. That's not the answer to lose weight. The brain needs sugar. If the body doesn't have enough sugar in the body will start to slow down. The body will start to shut down because if there's not enough sugar in the body cannot function. Okay, right now I'm talking to you right now because there's enough sugar, there's enough glucose in the body, because that is what my brain needs to function. It needs glucose. That's what my heart, that's what everything needs to function, is glucose. Okay, so if there's not enough, the patient will have classic signs of hypoglycemia, meaning low blood sugar, which is tachycardia, jitters, and palpitations. Okay. So when the patient has all those symptoms, they already have low blood sugar. So if we call the physician for additional insulin order, then that blood sugar is going to go even lower. Okay. So that patient will die. So we will not call the physician for additional insulin order. But thank you so much for giving that answer, because when we have a question, when we think of, and this happened to me so many times, I promise you, when we have an answer and it's wrong, I don't care how wrong it is. You may feel bad. Don't feel bad, because you are doing the right thing by asking the question. Okay. Remember, I said there's no such thing as a stupid question. I'm so happy you asked that question, but this is why it's wrong. The whole important thing is that you understand why it's wrong, and you really know why it's wrong. Don't lie to yourself. If you don't understand, ask the question and I will re-explain. The whole thing is to know why it's wrong. Okay. And be honest if you don't understand it. I don't care if every single person in this room understands it and you don't understand it. I want you to understand it. That's the whole point of me being here. Okay. And you wouldn't restrict salt, because salt has nothing to do with diabetes at this moment. Okay. And you wouldn't give nitroglycerin and perform EKG, because that has to do with if the patient's having a myocardial infarction, otherwise known as AKA heart attack. Okay, you may want to perform EKG later, but that's not the main thing. The main thing is you're going to want to check the blood glucose levels. So the first thing you do when you see a patient has signs of hypoglycemia, you want to check the blood glucose level to know how low it is. Then you're going to want to administer carbohydrates like crackers. You can either administrate orange juice too, but don't put sugar in the orange juice. That's the old trick. You don't want to do that because that will bring the blood sugar too high. Let's see what you guys are saying. Yeah. So Claiborne Mathis says, yeah, their blood sugar is low after administering the insulin. Yes, that is correct. Let me see. Yeah, their blood sugar is low after administering the medicine. All right. So Scrubs said, oh, yeah, I'm tripping hard. The nurse would give the patient orange juice with added sugar and or crackers. Yeah. No, but don't add sugar to the orange juice, because then that will spike it too high. Okay. And then you're going to have then you're going to have a hyperglycemic patient, which is not good, because that could cause diabetic ketoacidosis. We're not going to go into it because I don't want to confuse you guys. All right. Well, when the sugar is low. Okay. Yeah, so Tama says, okay. Scrub says, yes, ma'am. It's like, LOL, girl, they do that at the hospital I work at. Girl, I know. Yeah, they used to do that at a nursing home I work at, but that's wrong. Like, that's the part where it's like, this is all about the test. It's all about the exam. People do things their own way, but in order to pass NCLEX and nursing school, you want to do it the book way. But I do advocate to do it the book way at all times, all right? Because you never want to be put in a situation where you get in trouble. Give the patient okay with sugar in it. Yes. So no, don't put sugar in the orange juice. And maybe the NCLEX may ask you that question, or maybe your teacher might put that as an answer, like, oh, teacher may be like, oh, I know some of these people are nursing assistants or techs. Maybe let me put this question. Maybe they think it's right. Don't put that, because it's gonna spike the blood sugar up. OJ, but noted, sis. Yes. Hey. All right, guys. So wow, it's 4:09. So it's been 2 hours and 9 minutes. I said it was gonna be only 2 hours, but it's been 2 hours and 9 minutes of my first ever. It's crazy because she did. Yeah, girl, I've seen that too. I have seen that too. All right, guys. So, anyways, it has been, let me see. Aw, Tama says, when you going to be live today? You made my day today. Thank you for your help. Aw. The shopping woman says, thank you, Kimmy RN. Oh, thank you. Well, it seems like Sundays are good days. What do you guys think? I don't like my schedule is kind of like out of whack right now. I kind of make my own schedule a little bit. So I think Sundays are good. Oh, Claiborne Mathis says, I appreciate the view. You're welcome. So I think I'm going to make it Sundays, guys. You like Sundays around 2 or 3 Central Standard Time? The shopping woman says, yes. Okay, good. And I know, I'm sorry for those of you guys who are watching this video after, but you guys see the live. But let me tell you guys something. Like I said, if I could, I would do it every day. So every single person would have it off. But right now, if you guys didn't watch my last update, like I said, I just moved from, well, I didn't just move. I moved in January. I moved from New York to Texas. I was in, I have to make an update video about like nursing and like my career right now. But I was in Fort Worth. Now I'm in Houston. And, it's been a lot. It's been a lot. Like a lot has happened and a lot has changed. But you know what? I'm growing. I'm learning. So I think Sundays around 2, 3 is like a good time. And I think I'm so happy that you guys find that very. I think we finished everything. Did we finish everything? Yeah, I believe we finished all the questions, which I'm happy about. I think that yeah, I'm so happy that you guys really, really enjoyed it. So, but yeah, I'm so excited. I'm so happy you guys enjoyed it. So I'm gonna make this like Sundays from now on. I'm gonna keep putting flyers out. This flyer was actually extremely last minute. Like I just did it last night. I put the flyer out and I'm so surprised that like I think the highest number of people I had was 14. So definitely make sure that you guys thumbs up this video, like this video. If you guys like the way I teach, if you guys like the way I explain things, give this video a like, because this is how YouTube can let others know that I'm there, and that's what encourages me to make more videos. And that helps me, that helps the channel grow and stuff like that. And if you guys like these kind of videos, like definitely give it a like. And like I said, guys, I'm working on a course for you guys, so that's why every week I'm going to do it, because that lets me know exactly how I want to make the course. So the course will be basically a study guide, a supplemental study guide for you guys to use while you're in nursing school. Because I know a lot of the times these professors, some professors, I'm saying all, don't care. They just read off the PowerPoint slides and go on your way, and you are left to pull from this website and this YouTube video and that, this and that, this. And I want to put that's what I had to do. I want to put everything in one package so that you guys can be extremely successful in nursing school. Like I said, I humbly say this. I feel like I was very successful because I was able to crack the code and I had enough time to crack the code. I know everybody has a different life situation. Like some people have kids and stuff like that. But I was able to have enough time to crack the code and to see how exactly they want me to learn. And I just graduated in November. So all this knowledge is fresh in my brain. So why not put it into a course? Why not help you guys? Scrubbing Scott says, yes, I can definitely see you being instructed. Thank you. Yeah, I guys, I totally enjoy teaching you guys. I totally enjoy teaching you guys. I totally enjoy helping you guys go into your journey, go into your purpose, go into your calling, because you know what, when you do have if you do have a patient who comes to you like with diaphoresis and shaky, like we're all answering questions and it's all like a question game, but in reality, like that is very scary. Like I've seen that happen before when I work in the jail, when I worked in a nursing home. Like I've seen that happen, and that can definitely be scary for sure. And I understand the responsibility of like taking that mantle and helping you guys get there. And in my opinion, I don't think the key is to make nursing school so hard and difficult to pass just to save people's life. I don't think it's about that. I think that's where nursing school, most nursing schools get it wrong. It's not about making the school so hard because a lot of people's lives are in your hands. It's about making sure you know how to make your student understand the way they learn, or as close to it as possible, so that they will not make a mistake. That's the whole point, to make them understand how to think critically. That's how you make great nurses, not by making it so ridiculously hard that they feel like giving up. No, it's by making it's there. In my opinion, nursing school job is to train people to know how to think critically like a nurse so that mistakes don't happen. It's not about making it so hard because those people's like, no, it's about teaching them how to think so that the mistake does not happen. If that makes any sense. That's just my opinion, you know. But yeah, guys, I'm so happy you guys came at so short notice. I'm so shocked. Like I'm so shocked by how many people stayed on the live and how many people watched. I didn't know that, all of you guys needed help, but I'm so happy to help you guys. And, any way I can help is amazing. And yeah, like I said, I know how it feels like to feel like you're asking a stupid question. I know how it feels like for the whole class to be like, she still don't get that? What? Like, I know how it feels like, and I feel like that's what makes me different from any other instructor you'll see out there is I'm not gonna be the one to put you down because you don't understand it. Like, oh, because someone said, oh, it's easy. No, it's something maybe easy to one person. It could be easy to 99% of people and hard to you. And I'm gonna make you understand so that it is easy for you, because that's how I am. Like, I know I sucked at math growing up. That was one of my hardest subjects. And I remember my sister always being there for me, teaching me over and over until I got it. And even when I was like telling my sister, no, I don't get it, I don't want to do it anymore, my sister never gave up and she made sure I got it. And I wasn't the best math student, but I was in the honor roll. I was able to do certain stuff because I had somebody who believed in me when nobody didn't, when people thought I was stupid and dumb. I had somebody who believed in me, which was my sister. Oh, I love you, Sarah, if you're watching this. I had somebody who believed in me and loved me enough to never give up. All right. My sister and my mom never gave up on me. So yeah. Tama says, thank you, my friend. Manu, you sharing the link to me. Oh, somebody shared my link. Oh, thank you, Manu. Ooh. I think you guys are Haitian. Saka fed. Woo, woo. All right. Chris Kait says, hello, Kimmy. Congrats on being the new RN. Thank you. Woo! Chris Kite said, I know the feeling, huh? You know what? To this day, when I see my name on PCC, it says Kimberly Dawson, registered nurse. Did I say my name? Oh, y'all didn't hear that. But when I see my name, oh my God, I can't believe I said my name. Oh my God. I'm still shocked, you know? Okay. Our Beautiful says, yes, that will be me asking 1,000 questions, not because I'm dumb, but because I want to make sure I get it and completely understand. Math is not my complete. Yes, Our Beautiful. Yes. And, you know, that's what's so hard. Like, I understand that. And that's why I felt like stupid, because when I was little, I would always ask a lot of questions. And like sometimes people would be like so annoyed of me asking questions. They're like, how come you don't get that? Or you always asking questions. And I remember I would ask questions like, yo, are you dumb? Don't you know? And I would feel so bad, but I would still ask questions because that's just my personality. I'm like, okay, I'm still gonna ask it. And then I would feel bad when I would get like a 40 on a test or a 20 on a test on a 10. I've been there. Okay. I've had a 16 on a test. I've had a 20 on a test. I've had a 45. I've had low scores in my life, and I'm here and I'm telling you it is possible. Okay. First generation American, had difficulties, issues, all of that. And I came out, and I went to RN school during COVID, and everything was breaking out, and my family was affected. Like, I was in New York City, which is the epicenter of the virus, and all those kind of things. I probably shouldn't say that because I don't want my video to get flagged or anything, but I've been through all the things, and I still managed to pass nursing school by the grace of God and Nclex by the grace of God in the least amount of questions and come out on top. And I'm telling you that it is possible with hard work, dedication, and just with someone to teach you how to think how they want you to think. That's basically it. Okay. That's basically it. All right. So that's what I'm telling you guys. It is possible. And I'm here to help you guys. And oh my God, like, you guys warm my heart. Like, when I hear that you guys really benefit from it, like how Tama says that my friend Manu for sharing the link to me, like the fact that my link is being shared, like, oh my God, you guys are sharing my link. I'm just over the moon, because I really wish, like, I know there are people in this world who just give up on school because they don't get it and because they are made to feel stupid. Well, you are not stupid, my love. My love, you are not stupid. Do not believe anyone. I don't care if it's a professor. I don't care if the professor has a doctorate behind their name. I don't care if it's your own mother that birthed you, your father, your sister, your cousin. Don't believe anyone who says that you cannot reach your goals. I don't care if it's a supervisor. I don't care if it's a director. Don't believe anyone who says that you cannot reach your goals, because you can. Okay. Tama said she's sharing to all her friends in nursing school. Thank you. Mwah, 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 mwah. The shopping was 100. All right, guys. So it's been 2 hours and 20 minutes. I think I'm gonna post this. I'm gonna try to download this video and post it on my Instagram, because I know I have a lot of people on Instagram following me too. But don't forget to like this video, subscribe, hit the notification bell, so that next Sunday I'm going to give an announcement, but most likely it will be the same time next Sunday at 2 p.m. Next Sunday for our other review. And don't forget, I'm working on the course. I'm working on it. I think I'm going to put it out in sections, but I'm working on the course for you guys, and I know it's going to be excellent. I know you guys are going to benefit from it. And until then, don't forget to follow me on Instagram at KimmyDTV. And if you guys have any questions on any of the questions we went through, leave it in the comments down below. Rewatch this video, and I'll see you guys later. Bye. Au revoir. Oh, what What did Thomas said? You cannot eat. Why can't you eat? Eat. You need food. Need that blood glucose to help you think through those questions. Aww. Bye. Don't worry, guys. Tama, if you have more questions, just she said I cannot wait. Oh, she says I cannot wait. I can't wait either. Yeah. So like I said, I would do it every day, but because I'm working on the course, it takes a lot of time to do the course. But don't worry. Next week, I got you. All right, guys. Bye.